As we told you earlier, September is Prostate Awareness Month also, and prostate cancer is one of the most common types of cancer in men. For more information on the signs, the symptoms, the treatments, we turn to Dr. Christopher Atalla. Dr. Atalla is a urologist and a robotic surgeon for Catholic Health Services. Thank you so much for joining. And this cancer, more than 190,000 men will be diagnosed with prostate cancer this year?
That's right. Prostate cancer is the second most common cancer in men, and that's why it's so important for us to bring awareness to the disease and to get more men aware of it and diagnose so we can treat it and take care of it.
What are the symptoms of prostate cancer?
Well, that's kind of the scary thing about prostate cancer is it generally doesn't have symptoms, and that's why screening is really important to find those men that may be more likely to have the cancer. So it's important to diagnose it early.
So is this something a man should be screened for every year, or is it a certain age then you start to be screened?
Yes. So generally, we recommend starting screening around the age 50 all the way up until age 70. However, if you have a family history of prostate cancer or African American, we generally recommend starting screening early as age 40.
And it can be caught early, correct?
Absolutely. It's a very treatable disease when caught early.
When you say very treatable, what are the treatments?
There's several treatment modalities. There's surgery, robotic surgery to remove the prostate entirely. Radiation is another option. And both of those are done to cure the cancer.
There's been a lot of, can you clear up PSA tests for us? There just seems to be a lot of confusion about should everybody get a PSA test and what they are?
Right. So the PSA is the blood test that screens men for prostate cancer. And generally, men aged 50 to 70 should be screened annually with this blood test to check for prostate cancer. It's not a perfect test, but it's the only test we have at this time to assess a man for the risk of prostate cancer.
Is there a number that they have to look out for?
Generally, the number is, we want the number to be less than 4. If the number is greater than 4, then you should be talking to a urologist about what your options are, whether or not a prostate biopsy is something you should consider to look for prostate cancer. And that's a discussion you need to have with the urologist.
And the treatments are, again?
The treatments for prostate cancer are generally either radiation or surgery to remove the prostate.
But survival rate's extremely high if caught early.
Correct. When caught early, prostate cancer has a very high cure rate with either of those treatment modalities, be it radiation or surgery.
So again, extremely important to get screened.
Absolutely. Absolutely.
Okay, thank you, Dr. Atalla.
Thank you.